Thank you all for joining us today. We have a great session. I'm Ranjani Rangan with CharmHealth, and I'm your moderator for this webinar. Today's webinar is Empowering Mental Health with HealMed's AI-powered care delivery platform. A bit about CharmHealth for newcomers. CharmHealth is not just an EHR company, it is also the home of the CharmHealth Innovation Challenge. We are a thriving platform where technologists and clinician entrepreneurs come together to connect, ideate, and thrive. Our objective with our innovation arm is to nurture clinician entrepreneurship through the dynamic platform we have. We achieve this not only by providing a conducive environment for collaboration, but by creating space for our entrepreneurs to connect and incorporate valuable feedback from clinicians like you. In this way, we aim to grow our marketplace with relevant technology for our user base. Today's guest is Dr. Nidhi Goel, a dual board-certified adult and geriatric psychiatrist in New York. With vast clinical research and leadership, she's affiliated with institutions like the Maimonides Medical Center. As a healthcare innovator and medical futurist, Dr. Goel emphasizes working smarter for better outcomes. Dr. Goel is passionate about transforming healthcare delivery. Today, we'll discuss her software, HealMed Solution, an AI-driven health tech company addressing gaps in mental health care delivery. A small note, Dr. Nidhi Goel participated in our Innovation Challenge last year. She received the second place prize for her solution. Today, we're very happy to have her dive into detail. So before we delve into this discussion, let me cover a few quick technical housekeeping notes. You can submit your questions through the webinar by typing them in the QA box. We encourage your participation. Today's session is being recorded and will be available after the event. And those of you with burning ideas for future webinars or blogs, we invite you to share them with us in the chat window. We want the information that we bring relevant to you, and I will be on the lookout for them. Reach out to us at charmalot@medicalmind.com with your suggestions. Once again, thank you so much for being here. And now on to Dr. Nidhi Goel and HealMed Solutions.
Hello, everyone. I'm Dr. Goel, a psychiatrist, adult and geriatric board certified, and I'm very happy to be here having this conversation with Ranjani and presenting to you about new initiatives in behavioral health integration to primary care channels. So again, hello, everyone. And from here, I will present to you about what we are doing and how we can help you. So I'm also a founder of this company, HealMed Solutions, being a psychiatrist, dealing and understanding the challenges we face and our consumers face, their family face, which is due to a very, very severe shortage of providers and exponential rise of mental illness. So it's causing a huge gap between demand and supply. Both sides of coast is considered to be low shortage, but every institution is looking to add on more providers. Around 60% adults and 80% children any given year do not get access to mental health care. By default, they are going to emergency rooms for their help, mental health needs. And if you have been to emergency room, you understand how difficult and frustrating that experience is for anyone. I will just give you a little synopsis of what is happening, but where there are challenges, there is also a new opportunity. With this 60% counties with zero psychiatrists today, all this burden is either falling into their primary care physicians. And when I say primary care physician, it could be GYN for women, pediatrician for children, and so on and so forth. So government, CMS, along with other professional bodies, have collected a lot of data to understand what will work. And they are now moving from sick care to more preventative services to help enable some of the programs. And one of the programs that they came up with is called a behavior health integration. And they have come up with CPT codes to enable primary care physicians to deliver that care. What are the challenges in care delivery? So this is a bit of humor, but not humor for those of us who are prescribers. We all love to see our clients. We all love to deliver care, but we all love to hate our documentation process. We are suffering staff, not just physicians, physician extenders, and other care providers. Nursing and nursing staff shortage is also a very, very challenging scenario. Reimbursements are going down. Medicare just slashed their reimbursement recently, and the overhead cost of managing practices is going up on regular year-to-year basis. So just a synopsis again of mental health care scenario in USA. As I said, around 50 to 60 million people do not get treatment any given year. What are the reasons for that? Affordability, lack of access, social stigma, lack of understanding of mental health, and lack of awareness of treatment results in higher percentage of untreated mental illness. People are mostly in denial of having a mental health issue. Even if they understand, but many of the population, they have busy schedules and they are not able to find time to acknowledge the needs for their mental health. Larger proportion of people can be treated by primary care physicians. But primary care physician with their very short duration left now per appointment, they find themselves unable to address the mental health needs and find it very, very difficult or challenging to help their clients when they do need to help them with their mental health needs. So this behavior health integration program really, really can help them achieve that. PCPs or primary care services who are aware of this program, they are not able to do this because either they don't have a trained service provider, or again, they find it very challenging to onboard a new initiative. So what is this behavior health integration program? This program is, as I said, a CMS initiative where it's in a collaboration with three important pillars, as I say. The primary or the treating provider, they are the billing practitioner for this program. We have a behavior health care manager who is the main person in charge of delivering this care. They are the liaison between the beneficiary, which is the patient, and between the treating practitioner. And then there may be a psychiatrist or nurse practitioner or therapist who can help support or give supervision for this program. So psychiatrist or mental health care provider does not need to meet with the client. This BHI program is non-face-to-face meeting, and it's a monthly service. And again, as I mentioned, there are billable codes to deliver this program. What are the benefits to patients to enroll in this program? So again, treatment of chronic conditions, diabetes, blood pressure, or any other chronic medical condition may be affected by individuals' behavior health. The example I use is a diabetic patient who's depressed will still eat the donuts and not do the things they are supposed to do. Proactive mental well-being and introduction to mental health services really help them understand what is out there and how their needs can be met. Of course, improved access to care outside of office visits, so they don't have to take time off from their work or make a visit, or travel time and other barriers to go to the office visit. And patients are much more comfortable discussing with a physician. They have built a relationship for years, rather than seeking out a specialist, which is a therapist or a psychiatrist, to address their mental health needs. What are the benefits to provider for this program? Medicare, this is sort of a value-based care program. So by enrolling in this program, you are participating in advancing these initiatives, which are measured by Medicare, which is Center of Medicare Services. If you do accept Medicare, Medicaid, it improves your merit-based incentive payment system, MIP scores. And of course, your reimbursement rates go up. What are the core requirements for this program? As I mentioned earlier, this program is delivered by case managers. These are called as behavior healthcare managers, and they have a continuous relationship with the patient. This program requires a standardized screening to identify clients or patients may already have a known mental health issue, and then a systematic assessment using a digital platform to continue to monitor them. It's a monthly encounter, so monthly 20 minutes time spent per patient for continuous patient monitoring is required for this program. There needs to be a care plan which needs a constant revision based on the improvement or otherwise for the patient. Once we are monitoring them regularly, hopefully patient should be improving with our care, but if they're not, then they need to be referred to a higher level of care or a specialist care. And coordination and facilitation of behavior health treatment, and helping them with timely access to the care. Who can qualify for behavior health program? People ask, what does behavior health actually mean? It can be anything, mental health issues like depression, anxiety, trauma, bipolar, some of the most common mental health issues, substance related issues, life stressors which impact daily living, physical symptoms which can be manifested due to stress. Patient may be presenting to your office multiple times for abdominal pain or chest pain, but it may be actually a physiological response due to their stress. Behaviors which are impacting their general health in sense because they are just simply not taking care of themselves due to their depression or severe anxiety, which is debilitating them, or behaviors impeding improvement in their medical health care. Again, as I mentioned, a diabetic who is depressed may not take care of their needs properly. Who can bill for this program? Any healthcare system, including rural healthcare clinics or FQHC, federally qualified health system, can bill for this program. Primary care physicians, family practitioners, non-physician practitioners, physician assistant, nurse practitioners, CNS, etc., and any specialty provider like cardiologist, nephrologist, OBGYN, oncologist, etc., can bill. And now CMS is saying even therapists and social workers, counselors can bill for this program. So I will introduce you now to HealMed, which is our initiative to help enable this program, help streamline this program if you are interested in enabling this in your own practice. How can HealMed help you? It is a clinical decision support system, a HIPAA-compliant platform, which helps from measurement-based assessments all the way to evidence-based care plans. It automatically stratifies the patient and create a population registry. We have a voice-based way of gathering assessment, and that helps in sentiment analysis using natural language processing, and it keeps on calculating the scores via machine learning. And the final thing, which is very, very close to my heart, which is documentation automation. So how do we do that? So for a practice with, let's say, 3,000 patients, and if we need to screen the population, so all the patients from this clinic will be enrolled on HealMed platform, and patients will be sent a link to take assessment either via text or email, or they can do it in facility itself. On any smart device, be it Android or iOS, patients talk to the app, system asks them question, they answer, and in the real time, all these assessments are recorded, and the scores are calculated automatically, and patients are put in buckets. These patients have low scores, they don't qualify for the program, or these many patients have mild score or moderate score or severe score, they may require higher level of care, because when we are talking about population-based program, one individual cannot go through all the screenings, and this helps because many prescribers or care coordinators may not even know how to correctly calculate scores, and but that happens, and that all that data can be reviewed by the care managers and psychiatrists on the clinician dashboard, and then that is converted into automated documentation, which can be verified and addressed by the team members and can be then sent for the billing purposes. So it's an end-to-end system from assessments to triage to review of the care plans, and finally for reimbursement processes. This is the patient-facing app where the system asks the question and patients answer the question. So even if they don't know how to read or write, they are able to interact with the system. Once they narrate the assessment, system is able to do a very, very comprehensive history, the initial history also, which helps understand and stratify all that data into different categories. A syndromic category, whether it's a unipolar depression or bipolar depression or trauma, anxiety, substance use. And it is in real time. There are recordings for patients with every statement they say. It is in their own words, so there is no ambiguity here. And this data is finally converted into a note. So this is, like I said, I'm most proud of. This whole work is done without human being involved from the clinician side. All this data is automated and in patient's own words. So there is, again, no guesswork here. This is the dashboard at glance, where we have population registry and care manager to help them to understand how many care plans were done, how much work is left, which patient needs to be reached out to. There is population registry, which also gives it at a glance, like how many patients are in severe score, or they just require BHI program, or they may be enrolled in a collaborative care program, which is the higher step where a psychiatrist or NP trained in mental health needs to be available for rounds and going over the treatment plans with the care manager, and so on and so forth. I will now show you a brief demo of the program so that you can see how it works actually. I'm sorry, someone texted me that they may not be able to hear the audio. I apologize for that. Uh, Anyways, moving on. So basically what that video showed was how patient was interacting with the app, and app was asking pertinent questions just like a trained clinician would.
Dr. Goel, would you like to go through that video again and voice it as the video is going?
Perhaps I can show it at the end of it again.
Yeah.
Sorry. Yes.
Your demo?
Okay.
Perfect. Yeah,
Yeah.
thank you.
Yes. Thank you. So moving on. So these are some of the CPT codes for behavior health management. 99484 is the code which is for BHI, or Behavior Health Integration Program. And the average reimbursement is $48 for that. Medicaid paid a little bit lower, but commercial insurance is paid higher, $52 or $53, depending on state and the plan. And the 492 is for initial collaborative care program, which is a 70-minute visit per month for the initial comprehensive evaluation of the client. And the subsequent months is 60-minute per month visit for the patients per month. Again, it's not one visit for 60 minutes. It's a monthly care coordination time, which includes a time for reviewing of documentation, reviewing electronic medical health record, discussing care with the mental health professional and the treating physician, and so on and so forth. And if the time moves beyond 60 minutes, then they can do the add-on code for another additional 30 minutes and at this rate. The RHCs and FQHCs can bill for the service under G0511 code at for 20-minute visit, it's $76. CMS allows both CCM, chronic care management, and BHI to run together. Only thing you have to be careful that you are not double dipping, that you're meeting with the patient or doing care for 20 minutes and then sort of charging that for both the new risk for Medicare audit. So 20-minute time for BHI and 20-minute time for CCM allows you to bill for both programs together in that particular month. And again, BHI can also be built with RPM, PCM, or other programs in this value-based care space for the patient. But patient, again, they have to give consent for both the programs. So how does this work at a revenue, at a practice level? Let's say there is a small practice for individual patients or individual practitioner with 3,000 patients in their clinic. With the ratio of 1 in 5, it used to be pre-COVID, now it is much more, but we still assume 600 patients have mental health condition. Not everyone will agree to enroll in the program. So even if around 360 patients enroll, so around 10-12% patient enrollment, a practice can see annual reimbursement around $250,000. So for a practice with 10 physicians, with 30,000 patients and 6,000 enrolling, by extrapolation, around $3.5 million can be generated just by the BHI, the lower code that I mentioned, 20-minute non-face-to-face time per patient per month delivered by a case manager. So this is how reimbursement works. So again, our approach here is healing minds of consumers, but also our physicians. It helps the practices, again, increase the revenue. It increases the efficiency of staff because rather than just sitting on computer typing up their notes, their work is automated. 70 to 80% of their work is automated. They can do clinical care more or spend more time with the patients. And that is what actually drives the right outcomes for the patient, rather than, again, just spending a couple of minutes with the patient and spending the rest of the time in doing the administrative work. And because we have standardized the way of collecting the data, it helps with measurement-based assessments and empower our newer task force, which I say the care managers who may not have that years of training like a specialist would, by giving them evidence-based care plans. So essentially, doing the right thing is what helps in this program. So our value proposition, as I mentioned, it's a clinician-centric approach to deliver high revenues for providers, but better outcome for patients. So it is a win-win for everyone involved in this particular program. As I mentioned, it's a timely triage process. Another example that you may know, a patient may come and say, hey, doc, I was thinking of buying a gun and shooting myself. What does a primary care would do in that scenario, right? They'll call 911, send patient to emergency room where they may say, I never said that. And like so much time is spent in arranging for everything, and patient may still get discharged, and it doesn't benefit anyone. So with this, they can give them an iPad. Patient can take the whole detailed assessment, and that note, which is automatically generated, can be sent with the patient if they indeed need to go to emergency room. Automated documentation really helps enhance efficiency of the practices, increase the provider revenue, so they're not shelling out anything from their pocket to do this program. Essentially, they're generating. Patient engagement is better because they're not waiting for months to actually 3 to 6 months now to get an appointment with a specialist. Their care journey, treatment journey starts right there. And the voice-enabled data really helps reduce the medical errors because nobody's typing from their memory at the end of the day what this patient said or what that patient said. So there is no presumptions here. It is what patient said. It is documented in their own words. So there is no ambiguity there. This program is designed by me. I'm a trained psychiatrist for over decades, and with help of my other colleagues. And the feedback, we have continued to iterate this product based on the real-time feedback from physicians and patients. How do we price this? So either practices can have just access to the platform, which gives them access to screenings, detailed comprehensive assessment, population health registry, and the stratification care plan of the data per patient per month. Or Some practices who do not have mental health care staff or case management, and they just want to outsource. We have a comprehensive full SAC support, as we call it, where we will provide the care managers and access to psychiatrists or nurse practitioners. And we will basically manage the whole program for you, but you will still remain the billing providers. Again, as the value proposition helps establishes the medical necessity, whether that person does belong to the program or not. So we are not missing out someone who may need the help. Around 30 to 40% patients with undiagnosed depression and anxiety really drives the medical spend 2 to 10x. So those that population can be helped in timely manner. Because everything is done by the patients, is digitally recorded, helps with audit and minimizes denials. It improves the clinician's satisfaction, and clinical staff can be used at the top of their licensure rather than spending time in administrative tasks or typing up their notes. It improves the incentive or the reimbursement for the practice. Patients feel much better. The outcome scores are improved due to improved access and shorter wait times. And the outcomes improve because if we do help them with their mental health issues, their overall well-being improves with this program. This is another value proposition. There is a score mainly for healthcare system. It's called as HADIS score, and for 100,000 patients, if HADIS score is not met, literally $17 million of reimbursement is missed every year. So HealMed really helps them capture that those metrics also, along with other metrics for outcome-based measurement, which helps align your incentives if you do participate in ACOs or VBC programs. This is our team. It's a very experienced team. Myself, as I said, I have one MD from India in social and preventive medicine, so it gives me a unique perspective of population-based program. I'm a trained psychiatrist in US and adult and geriatrics. I've worked in administrative roles, clinical leadership, research, private practice, state hospital for severely and persistently mentally ill patients. So I thank you for your time. And we do have integration available with CharmHealth. It's a two-way integration where they will send us the patient data and the notes will go in the appropriate place in your existing health record. Thank you for attending, and I will take some questions if you have at this point.
Yes, Dr. Goel, could you give us a demo of the product?
Yes.
Behavioral health accessibility is in crisis in America.
Can you hear it
Providers
now?
are overwhelmed. Wait times for patients are unacceptable. There must be a way to leverage technology to lessen these challenges. Founded by innovative psychiatrist Dr. Nidhi Goel, HealMed Solutions assists mental health professionals in preparing initial intake assessments in a professional, private manner. The process begins at either the physician's office, hospital, or outpatient clinic. HealMed provides a digital assistant to guide the patient through their pre-visit interview. This assessment can be accomplished by the patient from home or in the office.
Please share with me what has been troubling you lately.
I can't concentrate. I'm having a hard time sleeping. I'm feeling really anxious, and I'm beginning to get headaches.
Providers review the dashboard and supporting materials prior to seeing the patient. This cuts screening times down from an hour or more to just 5 to 10 minutes. The assessment captures a clear, complete, color-coded dashboard summary for mental health professionals. This digital assessment is backed up by a full transcript of the answers with video snippets for review, along with red flags where answers appear inconsistent or incomplete. Providers finalize their focused evaluation, perform and consolidate their mental status exam, and prepare their own treatment plan just as they normally would. The HealMed assessment generates the appropriate billing codes so that office staff can easily charge the right amounts through to insurance. HealMed reduces evaluation and care provision time by more than 50%, cutting patient wait times and getting them help faster. To see the solution in action and learn more, please set up a personal demo. We'd be happy to take you through the product. Thank you. Behavior
Thank you. I'll take any question at this point.
We have another question here regarding the pricing for this product.
Yes. As mentioned, if you're just using the platform, it's $10 per month per patient, active patient. But if you want the full service, so the lowest code for BHI, it's $30, which includes the care management time, review of the notes and everything. And for COCM, 110 for the first one, around 90 for subsequent months.
And how do we get this implemented, Dr. Goel?
So if you are using CharmHealth as EHR, you just have to put a ticket to the CharmHealth and send an email to CharmHealth and HealMed, and this will get us integrated. In the meantime, we will onboard you on the HealMed platform, which only takes 30 minutes of the time. And you can get started with the program right there and then. If you guys are interested in reaching out, please email me or text me and we can get it started right away. This is the number. Sorry. You can either reach out to CharmHealth or to HealMed, and we can get you started, like I said, within 30 minutes.
Yes, thank you for that. Are there any free trials available?
We can help you get access through Sandbox, yes, if you're interested.
If there are no additional questions, I will conclude this webinar. Thank you so much, Dr. Goel. As we conclude this webinar, I want to express our sincere gratitude. Thank you for your passion in transforming mental health care delivery. To our audience, thank you so much for your active participation and engagement. Healthcare transformation is a collective effort, so thank you so much. And we encourage you all to stay connected with CharmHealth. And if you have specific questions for Dr. Goel, please contact her at the ng@healthmedsolutions.com, if that's correct, and or support@charmhealth.com. On behalf of CharmHealth, thank you for being part of today's discussion. We look forward to connecting with you in future webinars. Until then, please stay inspired, stay engaged, and take care. Thank you so much, Dr. Goel. Appreciate it.